Difficulties in producing healthy sperm are among the most frequent reasons for male infertility. The primary reason for infertility in men is often the inferior quality of their semen. In this video, we will talk about the different ways we can adjust our habits to better this situation. My name is Dr. Sofia Carter. Here at the Kisney Center, we create informative videos every week. If you enjoy our content, please subscribe to our channel and pass it along to your friends and family members. So, what are the things that affect the quality of a man's sperm? There are three primary aspects that decide the condition of your sperm. 1. The total number of sperm present in your semen. 2. The movement ability, or motility, of the sperm. 3. And their proper shape and structure. A man with good fertility ought to have no less than 15 million sperm for every single milliliter. Men who have lower numbers will often find it harder to get their partners pregnant. A lower sperm count means there are fewer opportunities for an egg to become fertilized. After ejaculation, sperm have a very long trip to locate the egg, moving through the woman's cervix, then into the uterus, and onward through the fallopian tubes to find the egg. To make it through this difficult journey, sperm need to have the right size and shape, and also enough swimming strength to cover this extensive distance. Why is it that some men face fertility challenges? In about half of all couples who experience trouble with fertility, the issue is connected in some manner to the man. For 1 in every 5 couples, the man is the only reason for the fertility problem. Some fertility problems can be due to hormonal issues, health conditions that impact the testicles, or a problem with transportation that affects how sperm move from the testicles to the very tip of the penis. Still, for approximately 1 in 4 men, no specific cause is ever identified. The production of unhealthy sperm is the leading cause of infertility in men. Often, sperm of poor quality can be linked to lifestyle decisions or less healthy habits. For these men, taking active steps to change their habits could make a big difference in their fertility. Let's explore the ways we can better both the quality and the amount of our sperm. Let's talk about stopping the bad habits. Drinking too much alcohol or using tobacco products damages both the quality and the quantity of sperm. To improve your possibility of achieving a pregnancy, it is very important to stop these habits, or at least to lower them as much as you can. Carrying extra weight, eating a diet that is not nutritious, and not getting enough physical activity also damage sperm count and their ability to move. A balanced diet will make sure your body gets all the necessary nutrients it requires to produce sperm that are healthy and capable. Doing exercise on a regular basis encourages your body's own production of antioxidants, which helps to keep your sperm strong and in good health. Temperature plays a very important role. Sperm prefer to remain cool, which is the reason your testicles are located outside your main body. Raising the temperature of your testicles has a direct negative effect on sperm. Because of this, we should try to avoid 1. Choosing to wear clothing that is too tight. 2. Staying away from heated car seats, saunas, and hot tubs. 3. Not putting warm objects like laptops directly on your lap. It is also key to keep your stress levels down. Higher stress in your everyday life affects both your sexual function and the levels of your hormones, which is very bad for the production of healthy sperm. Now for some tips about sex. One large misunderstanding is that you must have sex every single day. This is simply not correct. If you are a couple who already does this, then by all means carry on. But for everyone else, you can still make the chance of pregnancy as high as possible by having sex every 2 to 3 days within the woman's ovulation window. The ovulation window is when a woman is at her most fertile. This typically happens about 12 to 16 days before her next period begins. Many different applications are available to help you keep track of your partner's ovulation window. One thing to definitely avoid during sex is the use of common lubricants. Some personal lubricants are not good for sperm. Many of them include ingredients that can hurt the survival or movement of sperm. Others can create a physical barrier against the sperm, getting in the way of the egg fertilization process, and can even harm the development of an embryo. If you are a couple who feels you need to use a lubricant, there are other options known as fertility-friendly lubricants you can find. These are made with a special formula to be safe for sperm, meaning they are designed not to hurt the sperm or stop fertilization from happening. When is the right time to talk with your doctor? If, after 1 full year of trying regularly, you have not been able to conceive a pregnancy, it is a good time to speak with your doctor about looking into things further. Your healthcare provider can ask for tests on your sperm to get a full picture of the quality, the quantity, and the movement ability of your sperm. Also, some specific medicines, like certain antidepressants, anabolic steroids, and anti-androgen drugs, can interfere with the healthy production of sperm. Therefore, you should have a conversation with your doctor if you are currently using any of these types of medications. What can we say about supplements? A healthy way of living and a balanced diet should be sufficient to give you all the important nutrients required to support healthy sperm development. Because of this, the majority of men will not need to take any extra supplements. Taking too many supplements might lead to more damage than benefit if your body is not lacking in those nutrients. However, some research shows that the following supplements, for some people, could improve the health of sperm, thereby raising the chances for a pregnancy. Supplements that could possibly be helpful include 1. Vitamins such as C, D, and E2, folic acid 3, L-carnitine 4, coenzyme Q10 5, the mineral zinc 6, selenium, and also N-acetyl cysteine. We wish you the very best of luck on your journey to improve your fertility. Stay happy and keep healthy, and we look forward to seeing you in our next video. Naturally, this video does not give individual medical advice and is made for informational reasons only. You should not consider this information as a replacement for professional medical advice, a diagnosis, or a treatment plan. Please do not disregard professional medical advice while seeking treatment because of something you have heard or seen in this video. If you think you could be experiencing a medical emergency, you should immediately call your own doctor or an ambulance service.